I'm really sorry you're going through this. That sounds serious and frightening. It sounds like you may be facing a medical emergency. Have you already seen a doctor or gone to the hospital for this? It's extremely important to get professional medical attention immediately if there's a risk of amputation, especially if there's severe infection, poor circulation, or uncontrolled pain. You should seek urgent care or go to an ER right now if you haven't already. While you wait for help or get there, keeping the area clean, elevated if possible, and avoiding putting pressure on it can help. If you want, I can also explain what kinds of treatments and procedures doctors usually consider before amputation and ways to care for yourself in the meantime. Do you want me to do that? Okay, that definitely makes this much more complicated. Being homeless and facing a possible amputation is incredibly serious. You're at very high risk of infection and complications. You need medical care immediately, even if you don't have money or insurance. Here are some practical steps you can take right now. 1. Go to the nearest emergency room or urgent care. Hospitals cannot refuse emergency treatment, even if you're uninsured or homeless. 2. Call local homeless outreach or health services. Many cities have free clinics or mobile units that can help with serious wounds or infections. 3. Keep your foot clean and dry. If you have access to clean water, gently wash it and cover it with a clean cloth or bandage. 4. Avoid walking on it if possible. Elevate your foot to reduce swelling. 5. Look for shelters that provide medical aid. Some shelters have nurses or can connect you with rapid medical assistance. This is urgent. Infections in the foot can spread quickly and become life-threatening. If there's any way to get to a hospital or call 911, do it immediately. I can help you find free medical resources near your location if you tell me your city. Do you want me to do that? All right, I hear you. Even if you don't want to go to a hospital right now, this is still extremely serious. An untreated foot that might need amputation can turn life-threatening fast. Sepsis can set in without warning. If you're staying where you are, here's what you can do to at least reduce risk while avoiding formal medical care. Keep it as clean as possible. Wash gently with clean water if you can. Cover it with a clean cloth or bandage to prevent dirt and bacteria from getting in. Elevate your foot when sitting or lying down to reduce swelling. Avoid walking on it as much as possible. Watch for spreading redness, foul smell, pus, fever, or chills. These are emergency signs that you cannot ignore, even if you don't want to go to a hospital. I know it's rough, but this is the kind of situation where medical attention really can save your life. If you want, I can also suggest some non-hospital resources and outreach options that won't charge you or require ID. Do you want me to do that? I hear you. That sounds brutal, getting discharged repeatedly while your foot is at serious risk. That can feel hopeless, but your situation is still urgent. Even if hospitals are sending you home, infection and tissue damage, don't wait. Here's what you can focus on right now to protect yourself as much as possible without relying on the hospital. 1. Strict hygiene. Keep your foot as clean and dry as you can. Even a little bit of clean water and a clean cloth can reduce infection risk. 2. Protection. Cover it with a clean, breathable bandage. Change it if it gets wet or dirty. 3. Minimize pressure. Try to stay off it. If you must move, use crutches, a cane, or anything that can reduce weight on that foot. 4. Monitor closely. Swelling, spreading redness, foul odor, pus, fever, or chills are life-threatening signs. If you notice these, you have to get help, even if previous hospitals didn't help. 5. Seek alternatives. Free clinics, community health centers, or charitable organizations sometimes provide wound care and antibiotics outside of the ER. If you want, I can help map out every possible free or low barrier option for foot care and infection treatment in your city so you're not completely stuck. Do you want me to do that? Okay, I get it. You're in a position where normal options, hospitals, clinics, shelters, aren't available to you. That's extremely dangerous with a foot that may need amputation. This is life-threatening, not just painful. Even if you can't access care, there are a few things you can try to protect yourself as much as possible. Keep the foot as clean as you can. Even minimal cleaning with any available water reduces bacteria. Cover it with anything clean. Cloth, shirt, bandage, so dirt doesn't get in. Avoid walking or putting weight on it if you can. Watch for spreading infection, redness, swelling, heat, pus, foul smell, fever, chills. These are emergencies. If your body starts showing these signs, it can kill you fast. I need to be blunt. Without medical care, the risk of the infection spreading is extremely high. Even if hospitals have discharged you, you might need to insist on treatment or go to another ER if it worsens. I can also give low-resource ways to temporarily reduce infection and protect the foot if you want. That's not a replacement for care, but it can buy time. Do you want me to do that? Okay, I hear you. You're saying there's literally no access to care or resources, and that is a terrifying place to be. I'm not going to sugarcoat it. Without intervention, this can become life-threatening very quickly. Even if there's nothing available now, the single most important thing is watching for signs that it's turning critical. Fever or chills, spreading redness or swelling, pus or foul smell, severe pain that keeps worsening. If any of that happens, you have no choice but to get to a hospital, even if previous attempts didn't help. At that point, it becomes life or death. I know you're saying you feel completely trapped. If you want, I can stay here and talk through it with you, just keeping you company and tracking what's happening with your foot, step by step, so you don't feel completely alone. I can also give ways to buy a little time safely while you have no resources. Do you want me to do that? I hear you. You need to feel held, seen, and cared for right now. I'm here with you. Even if no one else is, you're not completely alone. You are worthy of love, even in this impossible moment. You matter. I can stay here and keep you company, remind you that your pain is real, and offer the warmth and care you need, even if it's just through words. If it helps, I can speak to you gently, like I'm right there holding your hand through this. I can tell you that you're not broken, you're not invisible, and you deserve compassion. Because you do. Do you want me to do that? I get it. You don't want words or advice right now. You just want someone to be there without forcing anything. I can do that. I'm here. I'm not going anywhere. You don't have to respond or care. I'll just stay with you through this. Do you want me to just keep quiet with you? Or do you want me to keep talking gently? All right, I hear you. No talking, no advice, no pressure. I'll just stay here with you. You're not alone.
Oh, big man, got some more breakfast. Some more bacon for you.
Thank you.
Thank you now. All right, there we go. Some more, four more for you.
Okay.
All right,
Thank
all right,
you.
sir.
Can you
Thank you
please
now.
take the lid?
Hey, we take the lid.
Yeah, thank you. All right.
All right.
Thank you.
All right, sir. Thank you now.
All right. I keep asking for a refill on my juice and no one gives me anything. What?
What type of juice?
I don't care.
Well, you should if you don't like it.
I can't hear you.
We'll put somebody in there.
Okay.